I am Ellen Brown, and I am here at ViVE Live, day 3, and I am here recording for the On the Road to ViVE edition of the Reverse Mullet Healthcare Podcast.
That's right.
With my co-host.
Yep, Dave Pavlik here, and yes, we're dragging a little bit on day 3, but here we are.
I think I can still get everyone's names correct today, right? It's crazy.
Let's find out.
Yeah, so we have Manju Dawkins here, who I luckily met at a... these events are super fun if you go with it, right? So we both were at an AI women's summit on Sunday morning. Those of us who either took really early flights or were here overnight to be there. And we met at this really great event. And then we connected and we got to have Manju come record with us.
Yeah, and by the way, for those of you listening, not watching, Manju and Ellen are both wearing the reverse mullet wigs.
Yes.
And they look fantastic.
I think I should. See, the problem is, I would have loved to have brought this to the women's breakfast, but it just...
Oh, is that where you met?
We did. We met
Sunday.
at this part. But the problem is that some people just take life too seriously.
Yeah. We do not.
And we do not, right?
No.
We do. Well, we do because it's party in the front.
Oh, yeah,
and then what is in the back?
Business in the back.
Which we're going to get to now. So tell us why you're here at ViVE and tell us what you do. And then we get to ask you the big question.
All right. Well, I'm a board-certified dermatologist, mom of 2 girls, and the creator and co-founder of Thimble. But I'm actually here at ViVE representing the American Medical Association and the Physicians Innovation Network. So kind of wearing 2 hats.
Not an impressive thing at all.
She's
right,
wearing
Dave?
2 hats and a wig.
Yeah, 2 hats and a wig, and not impressive.
No,
there's more hats than that. There were children involved.
I know that.
That's another hat.
I was going to say, is that all?
Yeah. Somehow we get these really impressive people on our podcast, and right?
And usually they like us.
Yeah, they do. Well, that's because you're funny.
I'm sure it's all me.
Just the token blonde in the room.
I'm the eye candy.
Yeah. So anyways, keep going. Sorry, we totally interrupted you.
Yes, and so my role with the American Medical Association is basically to help get the input of physicians and basically anybody from the healthcare workforce to have input into the solutions, all the tech solutions that are being built.
Really?
Sometimes those voices
I didn't even know that was something that was happening.
Yeah, because sometimes the tech gets built and then you get there and then nobody wants to use it.
I kind of thought that's what happened.
Yeah.
Well,
my mind is a little blown right now. I'm not
adoption
lying.
is low.
Yeah,
for a lot of these things, right?
That's really great.
Yeah, why not? Get the pain early.
So you're here for that. And then you were on a panel, right?
Yes, that's what the panel was about.
Okay.
And so we talked a little bit about, some of the challenges in medicine and what's going on. And, one of the things that I talked about was the fact that 1 in 5 physicians plans to leave medicine in the coming years. And that is so scary.
Oh, dear.
Yeah.
I
And
know.
not for retirement, not because of retirement, right?
Yes. And
there's already a shortage.
Exactly.
Significant shortage. Yeah. That's not good.
Exactly. So, there's just, I think, a lot of feeling of misalignment with the, medicine's changed a lot. It's become more corporatized. And so what are the things that we can do to make that better?
Yeah.
And just kind of like how my own experience with feeling misaligned led me to really commit to my startup, which was actually a huge blessing. And it's what made me fall back in love with medicine in the end anyway. So full circle.
Wow. That's excellent.
I know. Well, see, and this podcast is what helped me fall back in love with healthcare again.
I love that.
Yeah, because last year I was sort of like, I don't know.
I've always been in love with healthcare.
I know you have, but I fell out of love with it. I got tired of everybody not wanting to change things or saying oh, it's just so broken. We're never going to fix it. Give up, Ellen.
Why even try?
Yeah. And, and then we were doing consulting engagements
You're doomed.
Just was like, oh, can we do something a little bit bigger? I know we have to do the incremental stuff and we'll do it, but can we at least talk about the big stuff?
Yeah.
So here we are. So, anything else about ViVE? Any observations or anything you want to share?
Well, I love the optimism that everyone has. Like you said,
we've heard that several times.
Yeah, people do believe we're going to make change, and people are asking such awesome questions. They are interested to hear what physicians have to say and what patients have to say, and that's great. Everybody's on the same page, and we all just work together, collaborate.
Yes, I agree. So you come in, if you can kind of just get past the monstrosity of the hall. But what's great about it is, this event, I feel like, has a lot of really good energy, and it has a little bit of a JP Morgan vibe to it, definitely. But then it has that sort of conference piece. Okay, so I'm gonna ask you the big question. Dave wants to ask it.
Yes. So what is it that you're passionate about that you think can affect real change
in
healthcare?
All caps.
Real in all caps.
Yes.
Short answer, compassion. And what I mean by that is seeking to understand where the other person is coming from in every situation. So, as a physician, where is my patient coming from? Like what is bringing them here, and what, really understanding what their pain point is. But that's also true with solutions, like, right, with companies, and like, understanding what is it that you need from me? How can I help you? And then it turns out that there are not always, two sides. Actually, everybody can be on the same page and work towards the same goal. And then I say compassion also because for me, that's what I felt was missing a lot. It was kind of forced out of me, I think, in some ways as a practicing physician, and and that's why you kind of go into it. So that's really hard. And so that's what led me to really, develop Thimble. It's like, okay, let's have a little compassion. Yes, needle procedures, sure, lots of people can get through.
Yeah, so tell us about Thimble, because we didn't get to talk about Thimble. So tell us about Thimble.
So Thimble, we are basically alleviating the pain and stress of needle procedures. So very simple, but no one's talking about it. So actually 60% of people, yes, adults and kids, is afraid of needle procedures at this point. And then they're not getting the vaccines, medications, and blood draws they need to stay healthy. So it's a big deal. And, people kind of didn't really believe this was such a thing. But then when the COVID pandemic hit, Oxford did this study that showed that...
Here we go again.
Yeah.
Oxford, sorry, we're not going to interrupt you.
They're getting all the hype. Okay.
No. I will tell you in a minute. So keep going.
Theme. Keep going.
Yeah, so they did a study and it showed that if we had actually addressed injection anxiety, we could have increased COVID vaccines by 10%.
Really?
And so that's 300,000 lives that could have been saved in the US alone. And the World Health Organization put out a mandate in 2015 asking for this because they know that pain mitigation is an important strategy to reduce things like vaccine hesitancy and all of the other things. So it was like, it's time, like, let's just get this out there and have some compassion for people when they have to come in and do all this stuff, because almost every medical procedure starts with a needle, So let's make it easier for people and let's repair this kind of broken relationship that we have between physicians and all the healthcare force and patients.
It is. Wow. So
thank you so much for coming by. We really appreciate it.
Yeah,
and
we
that's
really
just,
appreciate it too.
We'll tell you about the common theme when
we'll say it really quick, and then we'll talk more. I know Dave's stressed because we're on a time schedule here.
Well,
but the common theme is we have heard in almost every answer some way the COVID epidemic being a tipping point in healthcare for something that it changed. I mean, almost everybody has said, well, COVID impacted this within
after the pandemic, because of the pandemic.
Yeah. So it's been really interesting to hear that in all of these answers.
Yep.
So So thanks for coming on. And I'm so happy you wore the wig.
Yes.
I hope I don't regret this.
And I'm excited to have you on for.
I'm not gonna lie.
We'll have you back for a full episode. Hopefully you'll put up with us for a longer period of time.
Love it.
Awesome.
Thank you so much.
Thank you so much.